Hello friends, welcome to BMH Learning. This video is about hs-CRP blood test. CRP is a protein that increases in the blood with inflammation and infection as well as following a heart attack, surgery or trauma. The CRP protein is made by liver in response to above mentioned factors. Now there are two different tests that measure CRP, and each test measures a different range of CRP level in the blood for different purposes. The standard CRP test. It measures markedly high levels of protein to detect diseases that cause significant inflammation. It measures CRP in the range from 10 to 1000 mg per liter. This test may be used to detect inflammation. Next is the hs-CRP test, that is high sensitivity CRP test. As the name implies, it accurately detects lower levels of the protein than the standard CRP test. It measures CRP in the range from 0.5 to 10 mg per liter. This test is used to evaluate individuals for risk of CVD. Now, what is the relationship between the heart and CRP? In simple words, blockages in blood vessels called plaque are collections of products contained in cells including CRP. Elevated levels of CRP may predict risk of first heart attack up to 8 years in advance. How is the test used? This test may be used to help evaluate an individual for risk of cardiovascular disease, that is CVD. It may be used in combination with a lipid panel or with other cardiac risk markers to provide added information about heart disease risk. The test can play a role in the evaluation process before a person develops one of mentioned heart problems. So, basically, it can be used to evaluate your risk of a second heart attack. What does the result mean? Relatively high levels of hs-CRP in otherwise healthy individuals have been found to be predictive of an increased risk of a future heart attack, stroke, sudden cardiac death, and peripheral arterial disease, even when cholesterol levels are within an acceptable range. People with higher hs-CRP values have the highest risk of CVD diseases. Follow the given table for more information regarding risk of having heart disease. This was all. Thanks for watching.